Hello and welcome to another Tuesday Talk with Ruby Reese. This week we're jumping really quickly into a topic that we'd like to at least scratch the surface on, one that's really, really important that people hear about, but it may be triggering to some listeners. We'll be speaking with Vanessa, who is no stranger to this podcast, all about Munchausen by proxy disorder, which she has actually come across in her life as a trainer, a dog trainer. And while it's really interesting and important to at least get the word out there that that this may be important to know about and be able to identify, it may indeed be triggering because it does kind of have elements of abuse and things like that involved in it. So for those of you that might be sensitive to that topic, this one could be a skipper. Before jumping in, just want to give a quick update to Ruby Reese and dognutrition.ie. We've been kept really, really busy over the past weeks and months putting together our dog nutrition course, which is now live. It's online and it's self-paced. So lots of you dog professionals and those of you working with dogs and really care about nutrition might want to check out on our website. We've also been really busy with event season coming up. We've got a couple of live events planned for the next while, some dog events in particular that we're really excited about. And this is something that obviously it's the more exciting part of the year where we get to get out there and meet some of you face to face. And of course our online shop is keeping us on our toes as well, with lots of orders coming in for supplements and shampoos and treats and the whole lot. So that is also, taking up a chunk of our time. So before I take up any more of your time, I'm now going to launch into this really serious, but also really interesting topic with Vanessa. Hello, Vanessa. Welcome back to the podcast. How are you doing?
Hi, Killian. I am doing very well. I'm very happy to be here. I'm happy to be here, but it's a subject that I'd rather we weren't discussing, but we are.
I know, and it's a really, really important one, and I'm so grateful for you coming on and speaking about a topic that isn't always an easy one. I think everyone loves to talk about puppies, about enrichment, about the nice things in the dog world, and rightly so, because it's a lovely community and a lovely world. But I think it's also important to get information out there on the more difficult topics.
Yeah, absolutely.
Before we jump into the topic at hand, would you briefly introduce yourself for anyone that might not have heard your previous podcast episodes, which were great, and you can go back and listen to them, and may not have come across you yet?
My name is Vanessa. I am a dog trainer. I run Perfect Paws dog training, and I'm also a canine behaviourist, just coming up on 20 years now. My God, I feel so old. It's a long, long time. Yes, and I've dealt with many, many different issues, and this is, like all dog trainers, we've dealt with lots and lots of different kinds of issues, but this is one that may be slipping under the radar.
Exactly.
And yes, so I'm hoping and I have to say, this is not my area of expertise. I'm a doggy psychologist, not a human one. But this is definitely something I'm so grateful to be able to open the discussion on, because I believe we're not talking about it. Not here in Ireland anyway.
And I think this is so important to get across. Neither of us is a mental health professional in any way, shape, or form.
No.
We are not accredited to speak about this or diagnose this issue. So it's something that we would like to shed light on, let people know that exists, and then if people want to go off and find some professional help for themselves, someone else, etc., if they would like to do their own independent research, by all means, please do so. But we would like to shed a light on this topic. And this topic, as it seems we need to put a bit of a label on it, is Munchausen by proxy. When it relates to animals.
Proxy.
Okay,
yes.
So we're talking about Munchausen by animal proxy. What is this, roughly?
So many people, and for those who are not familiar with it, I'll explain it. There's Munchausen and Munchausen by proxy. And many people may have heard of Munchausen by proxy as a result of the case of Gypsy, a young girl in the United States some years back who was serving a prison sentence for having her mother murdered as a result of her mother having this condition, and her mother was falsifying illnesses and very bad conditions like cancer and inflicting different things on her daughter to present with these symptoms. But her daughter was not sick, and her daughter became resentful in the end, and sadly the outcome was this terrible thing happened in the end. So Munchausen is basically falsifying sicknesses, illnesses, to gain attention or for financial gain or to gain access to drugs for yourself, but you are imposing it on another person, or in this discussion, on an animal.
And that's where the bianimal proxy comes in, right?
Yes, you're imposing it. It's now called factitious disorder. So it was called Munchausen, but around, I think, 2013, it was then changed to factitious disorder. It was believed to be just a behavioural issue. Now it's being recognised as a psychiatric disorder.
Okay, so we've got all these different terms, and that's not unusual for the medical or the veterinary world, as far as I know, or and psychology in particular. New labels come as research kind of deepens and kind of trails of thought kind of progress. So that's absolutely normal. So we can accept all the labels. It's not for us to disagree with any of them. And like, so we're obviously portraying or kind of seeing illnesses in other people or other animals in this sense. Do we know, or does the research indicate whether people, compulsively make these things up, like a compulsive liar, but they know that they're lying? Or is this something that they truly believe that, that this dog or this person or this whatever has, actually is inflicted with the medical issues?
No, in the case of Munchausen by proxy, or factitious disorder, or also known as battered pet syndrome, BPS, the owner knows full well that the animal does not have any condition, but is inflicting condition on them in order to gain access to either attention or getting drugs or financial aid. Now, in some cases, they're not always inflicting anything. They're just making up fantastical stories in order to get that attention.
Okay. Right. Okay. So they understand what's going on, but
they
obviously have whatever vested interest in, like you mentioned, there's a couple of different kind of, I suppose, rewards in their minds. So, they're aware that this is the case. Okay. And so when it relates to animals, like, I'm really, really interested in this, and it's it is a difficult topic, but I think we need to broach on it. How is then this, Munchausen by animal proxy interpreted or recognized in the context of pet ownership? How could we see this, and how could we distinguish maybe from, your average pet owner that also cares quite a lot about their dog and may jump to the worst conclusion when they go to the vet immediately?
So you might have the over anxious dog owner, and then you've got the Munchausen by animal proxy dog owner. So there is a wonderful psychologist in the US called Dr. Mark Feldman, and he is a specialist in Munchausen by proxy, and he is one of the people who has studied Munchausen by animal proxy over the years, and he has gathered together all the very classic symptoms that you see that come with both conditions, whether it's being imposed on a child or being imposed on an animal. So there are a few things. I'll have to go to my trusty little notebook here because I had to write everything down to be sure. First of all, when they come into the veterinary hospital, they will usually inform the vet of the injury or sickness the animal has. They don't come in like the rest of us and we say, well, they've started to get sick and I don't know what's wrong. I don't know why it's happening, or they seem to be limping a bit, but I didn't see them fall or hurt themselves. I'm not sure. The person with Munchausen will come in and say they've ruptured a disc in their back. I want something done. So they will already have pre-diagnosed the condition themselves, and then they will proceed to demand that certain procedures take place. So it's not allowing the vet to do their job. It's demanding the vet do the job the way they want it done. So they will tell them what they want done, whereas an over-anxious dog owner will be more inclined to come in, give the information that they have, and then sit back and wait for the vet to do their job. Whereas a Munchausen person will come in a very controlling manner and insist on what they want done. And ultimately, there's a goal in their head that they want to reach. So they're going to try and twist it that way to get there.
Hmm. On that point, I worry about myself being diagnosed almost, and I know I'm only joking there, but it's because, you know, Dr. Google is the worst
Mm,
thing that we can do, and I'm sure, you know, every vet that speaks
mm,
with me hates me for that. But you know, I like to kind of like cancel things out, and we all love to advocate for our
mm.
dogs as well, and say, could we not do an extra test, or, you know, I'm happy to pay for extra, but it's not that, right?
Well, it's
It's more
not,
than
no,
that.
because the thing is that when the vet does do the work and they do go and say do an MRI scan or they do an X-ray or they offer a treatment, then the person with Munchausen is not going to take that treatment on board. They will
Yeah,
actually begin
yeah.
to argue and, in some cases, abuse the vet to get their ultimate goal. If it doesn't go their way, they sometimes become aggressive because they
Yeah.
want it to go their way because they have a predisposed goal before they even walk in there. It's not actually
Okay.
about their dog at all. It's about
Sure.
getting the goal. It's about getting the attention for themselves.
And that's where the
So,
difference comes in, because I
mm,
would be more likely to say to a vet, I know there's only 1% chance of this, but could you take a sample anyway, seeing as you're already doing
yeah,
whatever, and send it
hmm
off to the lab, and then we'll get that back and we'll all be
yeah,
relieved, you
and
know?
then you'll
And
know. But
that's different.
the Munchausen owner will not be relieved,
Yeah.
even if they get an
Yeah.
answer. This won't be what they want, because if they get a diagnosis and a cure, they can't continue to get that attention that they need desperately. So they will take the medication away. Then they'll arrive back within 2 weeks and say, it didn't work. I knew that
Mm,
wasn't right. I want you to do this now. And they will continue that over and over and over and over and over and over again for months and months and months and months and months. There's also a classic symptom of vet shopping,
hmm.
which means they start to go to other vets with their dog. So, and unfortunately in Ireland, the systems are not connected between the vets clinics.
Hmm.
Unlike when you go to your GP, they are connected. If you go somewhere else, it's on your record. On the veterinary ones, they are not. So somebody with Munchausen by animal proxy can go to numerous vets and get the attention and get what they want without any vet knowing about the other visits.
Hmm.
And they quite often will. If they're not getting the result they want in one vet, they will go to another.
Okay. Right. So then that adds an awful lot of complexity to the situation, right? Because
It
if they're
does.
seeing multiple dog professionals, then they're going to, you know, probably build up a case as well
Yeah.
for this
Mm.
one goal that they're working towards, you know,
Hmm.
and use the professional knowledge
Yeah.
that's from other vets and other professionals
Mm.
to kind of
Hmm.
back that up, right?
Yeah, yeah, exactly. If the vets were all connected, it would be fantastic because the vets would be able to see, wait a minute, that person came to us, now they've gone there, but
Hmm.
we already handled this. Why are they going there? Oh, it looks like they've done a third one. It would be much easier to pinpoint the issue if they all shared their records with each other, you know?
Yeah. Yeah.
Mm.
I think, well, before that even happens, I guess chipping probably needs to come in, and proper identification, and knowing,
Mm-hmm.
like, the
Mm.
country really knowing
Yeah,
where the dogs are in the country, and what dogs are who,
exactly.
you
Yeah,
know,
yeah.
and really understanding and being able to
Mm-hmm.
log, because I presume that our human medical records are probably going through something like our PPS number or
They
something
are.
like that,
Yeah, yeah.
where and for a dog, you know, it's misspellings and
Mm.
changed addresses and things like that would all make a big thing. I think the chip would probably be,
Mm-hmm.
at least in my amateur ideal world, I think the chip would probably be a great place to
It would,
start logging that.
unfortunately, that itself is flawed at the moment as well. So it's very difficult for, I
Yeah,
really feel for vets in this
yeah,
situation
yeah.
because they don't know where to turn. If they do see that this is happening in their
Hmm.
clinic, they don't know where to turn. There is no protocol in place to help them. Who do you report this to? If it's in the case of a child, you can report it to the likes of TUSLA. But in
Yeah.
the case of an animal, they can't sit down and speak to that animal with a psychologist and test, is this and happening to you? This is a silent victim that can
Hmm.
never tell you that something is wrong. And in some cases it develops, can develop over time. It can develop, and sometimes it doesn't develop over time. Some people make up stories, and that's
Hmm.
where it ends. They just lies, and they go in and they make up the lies in order to get their goal, which is usually attention. Others do one called malingering, which is they go in and they make up lies to get medication, but they're going to take that medication themselves.
Mm-hmm.
So it's not actually going to be given to the dog at all. And then it can accelerate where they begin to, and this is the very difficult part and darkest part of it, they begin to hurt their animal in order to get that attention. So, and it could accelerate to that. It doesn't always, but it can accelerate to that point where they will start to inflict injury on their animal in order to get that attention back from their vet.
Now, I'm hoping we're going to say this is a relatively rare occurrence worldwide, right? This is not something that we're all going to be able to identify out in the street every single day.
I wish I could say that, Killian,
yeah,
unfortunately,
okay.
but it's becoming more common.
Okay.
And there was a study done in 2001 in the UK, and the conclusion was it was a study of 1,000 vets, and 1 in 60 was presenting with Munchausen by animal proxy. So that's only 1 in 60 in 1,000 vets in the UK.
1 in 60 vets had come across this?
No, 1 in 60 people had Munchausen by animal proxy.
Wow.
So they had detected 1 in 60. So it's quite a high number when you think about that. And in the US as well, they're seeing an increase in this too. But I don't know if it's ever been recorded here in Ireland, because I don't know that we're watching for it.
Wow. Well, I'm not sure if everyone even, or if most people, or if very many people even have heard that this exists. So, and that was the whole premise and reason that we said that we'd do this difficult topic podcast, because if you don't know about it, of course you can't make noise about it. You can't keep your eyes open for it. You can't, ask the powers that be, maybe invest in researching this, at least so that we know where we stand. And then slowly but surely, hope, with a little bit of hope, putting in measures in place to help the situation. You mentioned as well vets a couple of times, but I'm sure there's other professionals out there that could also be keeping their eyes open for this, right? I mean,
with dog trainers, in my own case, I have seen this, and it was only, I don't know that I would have noticed it, only that I was with the particular client for a very, very long time. So I was able to start to see it. But most of us, in my own case, most of the time when I'm training with people, I might be with them max 8 weeks. I'd be lucky if I'm with them beyond that. And during those 8 weeks, they could very well behave themselves because I'm around them. One other place that it can be seen is in boarding. So if you have an owner dropping a dog off into boarding and they're saying, oh, the dog has nutritional problems, that's why they're so underweight. And then all of a sudden that dog eats no problem while it's with you and puts all its weight back on and is absolutely perfect. You don't see any issues at all. It could be a little bit of an alert to this could be happening here, because quite often they will use food in order to manipulate an illness. They'll restrict food. And there's actually been recorded. In 1996, there was a case recorded in the US with Dr. Feldman of an owner restricting food to cause starvation in order to get attention.
Oh, okay.
And the dog was brought to a boarding house for 3 weeks, and the dog made a full recovery in the boarding house. And luckily, the boarding house was also the breeder of that dog, and the breeder refused to hand the dog back after the 3 weeks. And then a case ensued.
Yeah. And in this case, I'm guessing people, out there like groomers might also be able to see the telltale signs. For example, if a dog is losing weight and the owner is talking about very specific illnesses all the time, of course it's going to be more difficult to identify for them, because they're probably not going to be talking a whole lot about the medical.
They're probably going to be talking for a few minutes with an owner. But one thing that dog groomers do is they do get to know their clients very, very well, coming in and out.
Time, long time.
And people who have Munchausen do tend to have a lot of fantastic stories that are ridiculously over the top, that are not truthful. And most of us, I think, can see straight away, come on, that can't be true. So there's usually, it will come with that. A lot of very crazy, fantastic stories will come along with it. And you may recognize a little bit of it there, but it's very difficult to pinpoint it. I think the people that will be able to see it the most are the vets, because they're the ones that the person suffering with Munchausen is going to head straight for them, because that is the place you're going to get your attention.
Yeah, absolutely. And I suppose if a vet is validating your story in some way, shape, or form, or doing tests to validate your story, then
Yes.
that
Hmm.
carries kind of quite a high
Yeah. Hmm.
weight to it as well. A kind of a
Yeah, and I mean, our vets want to do the best for our
of
animals, so
course.
that when we come in and tell them we think something is wrong, they believe us.
Hmm.
Because they don't want to think that maybe somebody is doing this, so they believe you and they want to do everything they can to help. But I think there is a point where they can do everything and that person is just completely dissatisfied for no reason, then
Hmm.
it definitely is a red flag.
Yeah,
If
and
you've done it all and they're still not satisfied
yeah,
and they're
and
still coming into you. Mm.
and when we look at the dogs themselves, are there any behavioral cues that we could say across the board might indicate something isn't wrong in the home environment? Or is that
That's a
difficult?
very difficult one to
Yeah.
answer. It really is. In the case that I saw myself, I do see anxiety in the
Hmm.
dog. But that's only because I was spending a great deal of time in the dog's company. Now, I don't believe this dog was being made sick. I
Mm.
think this was just fabricated stories. Um, but in the case of a dog that maybe is being injured deliberately, you may see a fear of the owner not wanting to return with the owner to go home. Not just when they go to take them back from the vet, the dog shows resistance, does not want to go with them. Then I would definitely pay attention to that something's not right there. Because we
Hmm.
all know our dogs love us unconditionally and they're delighted to be going everywhere with us. And most dogs can't wait to get out of the vet. They're dying to go home. So if the dog is showing resistance, that's a little odd. If they
Yeah.
don't want to go with the owner, or if an owner is speaking and their hand raises up and suddenly the dog cowers back, why is that dog cowering back from its owner?
Yeah.
There obviously is something wrong, you know.
Do you
So,
think then for both vets and for any other professionals that are working with dogs that might come across this, how important then do you think it is to rule out every possibility, as early as possible so
oh,
that, that you can move
it's
forward?
it's detrimental because you also don't want to be creating a case against somebody who doesn't have this condition
Hmm.
and you've gotten it wrong and then you're causing terrible stress to them that they didn't need. I think it's very important to rule everything out first before you go forward with this. But there
Hmm.
are these telltale signs, these symptoms that do show with this, and they're not going to go away. So in the case of the vet, it may be numerous phone calls throughout the week, numerous visits, turning up without appointments, saying something is wrong with the animal, continuous emails, non-stop, abuse towards them when they don't give the answer that person wants, not giving medication when medication's been demanded, even though the animal has no diagnosis. The dog is well. So why demand medication if the animal is well? That's the malingering part of it. They're
Hmm.
probably trying to get the medication for themselves. So like the telltale signs, they are there. I think in the case of dog training, you may see them, you may miss it because you might be only with the client for a few weeks. In the case of grooming, you may form a relationship with your client. You may be more likely to see it there, and that'll be over long term because you'll have that dog coming to you for years for grooming. But
Hmm.
I definitely think our vets are our number one safe net when it comes to this condition.
Hmm. Has anyone looked in, particularly in the case of dogs, has anyone looked into researching how the long-term effects are then on the dog if they're getting long-term unnecessary medical treatments or even behavior work?
Mm.
Has
Not
anyone
that
looked
I'm
into it?
aware
No.
of,
Yeah,
Killian.
yeah.
I don't think this condition has really been recognised
Hmm.
only since about 1996 when Mark Feldman had that first recorded case, and
Hmm.
he's been studying it ever since. So it's still in its very early stages, and I think quite often it's probably not been taken seriously if
Hmm.
somebody did try to present with it. Um, it's a very tricky one because the pet can't tell you what's wrong.
Yeah.
It's very hard to do anything about it. Um, and yes, I believe that there hasn't been enough research done on it. There's some, um, and I definitely do. Actually, while I think of it while I'm here, I do absolutely recommend to everybody who is in the industry to get Mark Feldman's book called Dying to Be Ill, and there's a
Hmm.
whole chapter in it on this particular subject. And it tells you absolutely everything you need to know. And I think it really is good that everybody has it almost as a handbook just in case they need it. But I don't think enough research, there's research being done, but we're still very far behind on this particular field of that condition. You
And
know?
there's so
Mm.
many areas of psychology anyway that, you know,
Yes.
there's a lot of space
Mm.
there for improvement, and
And
you
it's
know,
extremely complex,
it is.
you know,
Yeah.
very
Yeah.
complex.
And
So,
thank you for that book recommendation as well. We'll put that into the show notes so that people can find it.
yes.
Absolutely, yeah. But I think research in general, I mean, we've only hit the tip of the iceberg to do
Yeah.
with psychology in particular when it comes to do with animals and human animal
Hmm.
relationships. There's a lot left to do. So,
Hmm. Yeah.
so yeah, definitely.
Yeah, but what I'd love to see is that as a result of us opening this discussion, and as you've
Mhm.
been listening to me, no, I'm not an expert on this. It's only what I've read and what I've been able to research myself in the last 12 months, having witnessed some of this happen throughout my career. Um, that it would be fantastic if the psychology community would cross with the veterinary and
Mhm.
get together and get this discussion going, and maybe have something introduced into the university curriculum so that vets will know what to do here. I know that in the UK, they actually do have a group set up that will
Mhm.
deal with unique cases, including this. So there is somewhere to report it. It's the Animal Welfare Foundation in the UK. They
Mhm.
now have a section set up particularly for these kind of unusual cases where vets can report it. But we have nothing like that here in Ireland. And it would be fantastic to see those two communities come together and maybe set something up so that vets can form a report, and they will have proof of it because they've got their appointment records there. They've got all the results from all the tests they will have done with an animal that the owner was not satisfied with and kept coming back and kept coming back. So they have records there to
Mhm.
build a case. Whereas a dog trainer won't have records there to build a case, a groomer won't have records there, but a vet will.
Sure.
And they can. It would be lovely if they had somewhere to turn that they could report this, that it would be investigated, you know.
And that's obviously like something that's extremely important for our country, and
Mm.
you know, it would be great if we could follow the example of other countries. I'm sure there
Yeah.
are ways and means of doing this elsewhere, but is there anything at the moment that we can do, or is it our hands completely tied, you know?
Well, I feel in my case, my hands are completely tied. There's
Hmm.
nothing I can do.
Yeah.
There's nothing.
Yeah.
Absolutely. I don't know where to turn with this. And if anybody listening to this who's working in that industry in psychology knows of anywhere to turn with this, please reach out. It would be fantastic to know, well, actually, you know, you can actually do this. But it's not being shouted from the rooftops, and it needs to be. We
Yeah.
need to know there's somewhere we can go when we come across something like this. Because in the case of animal abuse, in other ways, we can go to the ISPCA.
Hmm.
You know, where do you go with this? Because this just looks like an over concerned owner, but it isn't.
Hmm.
You know,
Yeah.
this isn't even actually about the dog at all. This is about gaining attention for themselves, not the animal.
Yeah.
You know, where do you go with this to get help? And what will be done
Yeah.
if you do? You
it
know.
kind it kind of shows, doesn't it, how like the
Mm,
level of complexity
hmm.
in the world that we live in. You know, it's not as clean cut. Is this an animal issue? Yes, it's an animal rights and an animal welfare issue. Is it a human issue? Yes, absolutely
Yes.
it is. It's a human psychological
Hmm.
issue that needs dealing with from a body that's not animal
Yeah.
related, probably. You know, it's more complex than that, and I think we always try to oversimplify our world a little bit, and
Hmm.
I think
Mm,
this particular kind of situation really goes to show how much more complexity it is. It's not
yeah.
always clean cut. It's not a cookie cutter situation
Mm,
here, and there probably needs to be a lot more coordination done to get kind of movement
hmm.
on these situations. Yeah.
The other thing I feel as well with this, I nearly forgot to mention as well, is it will present itself in other platforms as well. So sometimes people with Munchausen by animal proxy will post a lot on social media about their
Mm.
animal's illness. They'll put up videos, they'll put up photographs claiming this, and this is in order to gain that attention from complete strangers. So it happens on social media platforms as well. So you can, I suppose, if you knew of somebody, you could maybe take a look at that and see, are they doing this? Are they fabricating
Mm.
stories online? In the case of one particular one I was going through, they were
Mm.
fabricating stories online that were not true. They
Yeah.
were absolutely not true, you know.
Yeah.
So they are doing that as well as the vet shopping, and then the continuous visits, emails, phone calls to their veterinary clinic as well. You know,
Mm.
so there are a number of things happening. It's trying to pull it all together.
And when we've got someone that has, let's say the focus is on one dog that
Hmm.
we know that this is happening on, a
Hmm.
fictitious dog in my own mind, could it be the case that if that person then had children or other human relationships, does the research indicate that it can kind of, that we can see the Munchausen in various different contexts, so with animal, with a child, with other beings, is it, or is it always either the target is a child or a dog or a parakeet?
Well, the research I looked through was unfortunately only the animal one, but I imagine myself it could, but that's
Yeah,
not an
yeah,
expert
yeah,
opinion,
sure.
obviously.
Yeah.
But I imagine myself that if they're not getting the results they want with the animal, they could proceed to do it a different way.
Hmm.
And in the case of Munchausen syndrome, that's when you're presenting yourself fabricating illnesses and making yourself sick in order to get attention by proxy, is when you start to do it to somebody else.
Hmm.
So it could be that it starts that way and then elevates into, well, I'll get a dog. I'll see
Yeah.
if I can do it that way. Because I imagine that, and I imagine as well that the reason, well, this is only my own personal opinion, obviously not expert,
Hmm.
but I imagine that the reason it's becoming more common with canines is simply because doctors are now so much better trained than they were in spotting Munchausen,
Hmm.
that doing it with a child is much more difficult than it used to be, because now there is a shared database. They can see everything that's going on. And if it's taking place, they can very quickly start to focus on it. Whereas with an animal, it will go under the radar,
Hmm.
absolutely under the radar. Nobody will notice for a long
Yeah.
time, you
Yeah.
know. And then even if you do, where do you go? What do you do?
Hmm.
You know,
Yeah.
I mean, as you said before, you could contact the likes of the ISPCA and report it, but is it an animal welfare issue? It's not, in a way. It's not. It's
Yeah.
actually a psychiatric issue with the person, not the dog.
Yeah.
So yeah, it's a very tricky one. That's why I desperately wanted to open up this discussion, because it's actually tormenting me a little bit, because I don't know what to do. Mm.
Of course, and there must be so many people listening in that also wouldn't know what to do in this situation. I
Yeah.
certainly
Hmm.
wouldn't have an answer that just runs off the tip of my tongue, and it should be the case, if we see something wrong, that we should know where
Hmm.
to turn with it. So,
Yeah.
yeah, it's
And look, the one thing I do want to say is there's probably people listening who are a little bit over anxious dog owners, and they're thinking, "Oh my God, am I one of those? Am I one of these people?" No, you're not. You're absolutely not. Over anxious dog owner and somebody with Munchausen are two completely different things. Somebody with
Mhm.
Munchausen knows. They know they're abusing the animal. They know they're
Yeah.
doing it. But as an over anxious dog owner, they're not. They're not abusing their animal. They're just desperate for an answer to something that their animal may have, that they've done. No, they haven't done anything wrong. They're just trying to find out what's wrong. And then when they get their answer, they're happy. They go off, they get their medication, they're happy, they go, they do it. But in the case of that Munchausen by proxy, they're not. They will never be happy with your answer, because the minute that they're happy with your answer, the attention goes away.
Mhm.
And the only thing they want is that attention for themselves.
Yeah. Yeah.
Mm.
No, that makes total sense. And I'm
Mm.
really happy now as well, because I,
Mm.
I was a bit concerned earlier on in the podcast whether I could be seen as that. Well, probably you can interpret anything, but I now know, like, it's very easy for someone to
Mm.
tell whether they either you're making something up, you're completely fabricating a story, or you're just trying to count out all of
Yeah.
the worst case scenarios through testing and
Yeah.
and proper
I mean,
science. So that's
I
that's
think
okay.
one of the big red flags for a vet as well would be if somebody comes in and says, "This is wrong with my dog," and they go and do the tests and say, "Actually, that they don't seem to be matching up those
Mhm.
two things. That doesn't make sense."
Yeah.
I mean, if somebody comes in and says, "Well, my dog's leg is is broken,
Yeah.
and they go and they're, the symptoms that you're telling us don't match up with what's actually going on with the animal. Then you have to question what. And then they will do that again and again and again and again, and they will just keep coming back,
Mhm.
and they will never be satisfied with the answer, regardless of, how many times you tell them, this is what it is, it's done, there's the medication. The dog
Yeah.
will be fine. They won't. They will also interfere with programs set up by the vets for an animal. Say they do find something wrong with an animal and they've given them something that is going to cure it, is going to help it. They will interfere and sabotage with that so that the dog
Okay.
does not get well. Because ultimately they don't want the dog to get well, because they need an excuse to come back and get that attention again.
Absolutely. And I think I think when you begin to describe this, it sounds so difficult to kind of put your finger on it and identify it. But I think once you actually start digging a bit deeper,
Yeah.
now from what you're saying and what you've seen in the research that's actually been done, is that it's quite clear over time. But
Yeah.
you need to kind of build up a rapport and enough time spent with the client to be able to figure out.
Yeah, I think vets
This is
themselves
what
are
it
the
is.
best bet when it comes to
Yeah.
this.
Yeah.
They've got all the records there, and they will see it. They'll see this person arriving with an animal. Something's wrong with the animal. No, it isn't. They send them away. They arrive back. They've now fabricated a new story. This is now wrong with the animal. No, it's not. It's fine. They send them away. They come back again. Now this is wrong. They'll keep creating new stories, new fantastical things, and they'll always be big things, big injuries, big sicknesses, big things. They won't be, they clipped their claw and a little bit
Yeah.
of blood came out. It'll be something fantastical. And they
Okay.
will keep
Yeah.
it up. And when they don't get the answers they want, they will abuse the vets. They'll shout, they'll scream. They'll even accuse them of being terrible at their jobs. They want referrals. They want to go somewhere else. And then they will do the same thing when they do get the referrals and go somewhere else. They'll give that same behavior there as well. So there will be a record of it across the board, but it takes time to build all of that up.
Yeah.
That's
Absolutely.
going to, you'd be looking maybe a 12-month time span to actually gather all that information together.
Oh, it's incredible. It's a fascinating subject. I'm so thankful that you were willing to come on and help us to scratch the surface on it a little
Yeah.
bit. I think, there's so much work to be done here.
There is.
But I think the first step is definitely the purpose of us starting this, as we already mentioned, was just to get the information out there, because if you don't know about it, you definitely can't start identifying it and seeing the potential issues that could be there. So thank you so much, Vanessa, for
You are
coming on
welcome.
and
I hope I was
sharing all
clear,
that
because this is not my area of expertise at all, but it was one that was deeply concerning to me. It really
yeah,
is,
it definitely opened my eyes, so I thank you for that. And I think it's such a great springboard now for people to go on and do their own independent research and maybe get the help of other professionals that are specialized in this. It's so important to go and
hopefully
reach out.
maybe we'll have somebody reach out maybe we could do this topic again with somebody in the psychology field who specializes in this, who has much more information than I ever would, who might be able to shed even more light on it for us.
I like nothing more than a part 2. So
it would be great.
so please do reach out if anyone has other information, experiences, or education in this area. We'd love to hear from you.
It would be great. Yeah.
Thank
to
you
bring
so
the
much,
two
Vanessa.
fields together. Thank you so much.
Absolutely.
And thank you so much for having the courage to be able to talk about this very dark topic.
Right back at you. So appreciated. Thank you very much, and
You're
speak to you very
welcome.
soon, Vanessa. Thank you.
Goodbye.
Bye.
And once again, a huge thank you to Vanessa for coming on and sharing her experience with this really important and really serious topic. It's definitely one that we believe is something that we should all know about, know that exists, and be able to identify it as well. If you'd like to find out a little bit more about what Vanessa gets up to with her business and her training world, you can find all of the links in our show notes. There you can also, of course, find links to Ruby Reese and to dognutrition.ie and all of our socials as well. Thank you very much for listening in, and we look forward to seeing you for another podcast episode in just a fortnight.